Hi students and hi Pauline. I'm presenting regarding the peritoneal catheter. The type of catheter I'm presenting is Presternal peritoneal dialysis catheter. This catheter is a modification, a lower abdominal catheter that allows for an anterior chest exit. It was introduced in the 1990 by Twardowski in response to the need for an alternative location for which a catheter can exit the skin when an abdominal site is not suitable. It is two flexible silicone rubber tubes joined together by a titanium connector at the time of the implantation by surgeon. Catheter can be cut in lengths that allows for pre-external or upper abdominal exit site. The exit site is located in the presternal area or parasternal area. Intraperitoneal parts may have a mesory, swannic intraperitoneal design, which is the coiled. It is for permanent use, preformed or prefabricated, and it's spanned. Reason for use for presternal catheter, there is less movement with the chest wall than abdominal location, which facilitating healing and decrease trauma risk. The catheter located on the chest was designed to reduce the incidence of exit site infection compared with peritoneal dialysis catheters with abdominal exit sites. Types of the catheters, all presternal catheters have a swannic. This design modified on the time of insertion from straight swannic and coiled swannic mesory. The catheters are made of silicone. All of them are double cap catheter. The rationale for my choice and patient's view. This type of peritoneal catheter is an important aspect regarding the outcome of PD by improving the patient's quality of life. For example, the catheter exit location in the chest may be preferred by patients, both men and women, for psychological or body image reasons, extremely obese patients, and patients can wear their belt in any abdominal area, can minimize body image disturbance and prevent isolation. The patient can associate with the public, associate with the community because of the exit site, and they can wear occasional clothes and due to the body image and able to wear casual dresses by patients, especially for young patients, young adults. It is suitable for any patient commencing peritoneal dialysis and any age group of patients, for example, children who wear diaper. Advantage of presternal catheter, it provides an alternative location from which a catheter can exit the skin when an abdominal is not suitable, can give choice for patients who has ostomy, ileal conduit, renal fecal incontinence, and particularly useful in extremely obese patients. It's to reduce reoccurring refractory peritonitis, decrease inflow pain. Patient need to wear sweat pants with an elastic waistband. Patient who has desire to use a bathtub. Disadvantages of this catheter. Catheter should not be placed for patient needs to have open heart surgery. The exit site does not help to prevent trauma in children. They are more of a challenge to put in and it's done by few surgeons. More complicated to insert, have not been widely used, it's more expensive and need general anesthesia. Pre-insertion preparation for the patient. The catheter can be implanted by open dissection and laparoscopy in the operating room. Use general anesthesia. Patient assessment, for example, patient has hernia and considered to repair during the insertion. Assess any deformity on the chest sternum area that can affect the exit site. The surgeon determines the exit site by collaborating with patient to participate in their care and self-management. Patient education should be in place, if not done before, by nephrology team. Preoperative care of the patient, nurse ensure all this done. Consent are made by the patient and confirmed the exit site and marked by surgeon. Anesthesia is done. Knowing history of patient allergy and pre-op checklist done. Confirmed patient identification. Past and present medical history, for example, previous abdominal surgery. Monitor lab values, example CBC and INR, recent chest X-ray and ECG, and prophylactic antibiotic prior to catheter insertion. Send the medication with the patient. Hold blood thinners and some medication prior to procedure per hospital policy. VRA and MRI swab per hospital policy. Ensure the bowel preparation have done or administered for post-insertion catheter function. Post-operative care of the patient. Exit site dressing remains 7 to 10 days to minimize bacterial colonization at exit site during the healing period. The catheter tubing needs to be immobilized to prevent trauma to the exit site. PD catheter must be plashed with 500 to 1,500 ml fluid solution to check the patency. This can happen per hospital policy. Usually it's done in the operation room by surgeons. PD should not be started until healing at exit site and the tissue ingrown into the catheter duct and cuff have taken place, usually after 10 days. If dialysis is required prior or 2 weeks healing period, maybe APD with low volume, supine position, preferred in the night time, and we can start with low dialysis volume. After the catheter insertion of 2 to 3 weeks, the dressing should change weekly to eliminate contamination and reduce trauma from the catheter manipulation. During post-operative period, use antiseptic technique with face mask when cleaning the dressing. Change the PD site dressing frequently if contaminated or wet. Patient avoid submerge the new exit site into water to prevent colonization of waterborne organisms until healed. If it is healed, this kind of catheter, they can swim. The patient can swim. The long-term care of the exit site, it started the exit site healed. Protocol for cleaning catheter exit site will depend on facility, whether there is a soap, water, and provided iodine. Always assess and monitor. Report if redness, swelling, crusty, or tenderness notice. Harsh solution should be avoided, cause skin damage, which can predispose to bacterial infection. May consider antiseptic solution if the patient's immunosuppressant or immunocompromised due to infection risk with the normal skin flora. Always secure PD catheter to promote immobilization, reduce risk of trauma and infection. Swimming and bathing can still be considered as long as waterproof occlusion dressing is applied. Patients are discouraged diving. Hand hygiene should be done before and after touching the catheter and the exit site to prevent infection, peritonitis infection. Use prophylaxis for Staphylococcus at exit site for instant daily application of Maprocaine cream and gentamicin cream. A clean washcloth and towel can be used for the healed. Thank you for your time and have a wonderful evening. It's my presentation is done. I use some references. My references: dialysis catheter placement, Presternal peritoneal dialysis catheter placement by Skrina Miha and Margasari, and a system review and meta-analysis of the influence of peritoneal dialysis catheter type on complication rate and catheter survival, written by Hagen and LaFrance. And I use Anna book, American Nephrology Nurses Association, Module 3, page number 231 until 239. Thank you very much, And thanks so much. Have a good evening. Thank you.